Welcome to another episode of the Process Podcast. I am sat here today with Dr. Erica Tse, who is a chiropractor here based in Hong Kong. She's here with me to bust some chiropractic myths. What are they? And let's bust them. Okay, welcome to the podcast, Erica.
Thank you, Chris.
First question, being a chiropractor. So, first of all, can you please just introduce yourself in that way of like your history as a chiropractor and how long you've been practicing for and where you practice here?
Okay, so I am a registered chiropractor in Hong Kong, and I'm practicing in Hong Kong, obviously. I am now working for Up Health, which is a chiropractic clinic. I started working in Hong Kong around 2 years ago, and I did my studies of chiropractic in the UK.
Okay.
Yeah.
Right on. How long did you study chiropractic for?
Depends on where you do your degree, obviously. Mine, I did it for 4 years in the UK.
Okay. And what does that involve in terms of becoming a certified chiropractor?
Okay. So within that 4 years, obviously, a lot of theoretical stuff that you have to study.
Okay.
Anatomy, some general medicine, neurology, orthopedics. Some more specialized unit will be pediatrics and pregnancy. So that will be a 4-year studies. In the very last year, which is year 4, you will be in the clinic for the whole year, along with studying. So you can say it's a year of placement in the UK. And then you have to go through an exit exam to basically get registered in the UK or in other parts of the world. Basically get your degree.
So you're now registered in the UK, but also that registration in the UK also applies to here in Hong Kong.
You do have to re-register in Hong Kong because it's different locations. So that degree can directly transfer to Hong Kong, but you do have to go through a bunch of registration procedures, and you do have to wait for quite a bit to basically receive your license afterwards.
I see.
Yeah.
The reason why I'm asking such questions is, this is a topic that for me, and we've talked about this before, starting this podcast, was my own fears about the realm of chiropractic care.
Yeah.
Because there's a lot I don't know about it. And part of it is I didn't want to know about it based on, like a childhood trauma that I experienced when I was about 8 years old. So to catch up listeners on this, my parents got involved in, I think, like a rear-ending accident in California where we lived. And then as part of the insurance coverage, they were able to see a chiropractor to help fix whatever they suffered during that time. It wasn't major or anything. They didn't break any bones. But I guess, there was some whiplash involved, and they both had an appointment to see a chiropractor in another part of town in Oxnard, and I went with them. I don't remember why, but I was waiting there in the waiting room while they were getting adjusted. And I thought it was just like any other doctor's appointment, and then I heard like the cracking and the and like just the noises, the stuff that I did not expect, and then it sounded violent in a way to my 8-year-old mind. Sounded like a really bad time. So I've always built that up, and I'm thinking about being in that chair as a child at 8 years old, and I'm sure there's a lot of memories that are being conflated now by like chiropractor videos on YouTube and TikTok and stuff about like the crunching of bones and like people being like bent in half and people like screaming in pain or going, "God damn!" Like stuff like where it seems very much so that what they're going through is itself a traumatic experience. And that's why I have my own biases historically against the chiropractic care. So I wanted to talk to you not only to face these fears myself, but to dispel what I think are myths in the theory and practice of chiropractic. Which, number one, I guess before we get into the myths that we will bust, one thing I need to know is, how do you use the word in sentences? Because that always confuses me. So let's break this down real quick. The noun as a title. I'm going to see a chiropractor, right? So that's it. You are a chiropractor.
Yeah,
Your colleagues are chiropractors.
Yeah.
Okay, how about an adjective? So I am studying chiropractic medicine.
I am studying chiropractic.
Okay.
Just chiropractic.
Just chiropractic.
Yes. Do you
Okay.
want me to talk about this a little bit?
The word?
Yeah.
Yeah.
Like medicine or not.
Oh, okay. Oh,
Yeah,
sure.
because in my own understanding, not chiropractic, medicine will usually involve some sort of medications or perhaps surgery.
Mhm.
And people usually go for medicine when they have a disease
Mhm.
or illness. Whereas when people go and see a chiropractor, it will usually be either an injury
Okay.
or they have some sort of pain
Yeah.
issues. So I would say chiropractic, I won't say it's a medicine
Mhm.
for me, for myself. I do say it's a form of physical therapy for
Okay.
myself. Yeah.
Okay. So I guess to help with clarifying between the two, it sounds like what you're saying is medicine involves something prescribed that you ingest in some form, or a surgery that you go into under an operating table. That is what you would call medicine. Whereas something like chiropractic or physiotherapy, manual therapy,
Yeah.
any type of adjustment like that with the, I guess, hard or soft tissue, that wouldn't be what you define as medicine.
For me, yes.
Oh, okay.
Yeah.
But I guess maybe if the word isn't medicine, the idea of it being treatment for your symptoms or for the root causes or something like that. Because I have heard, this idea that chiropractic isn't more traditional; it's more like holistic. And when people think about that, there's associations with it's as effective as something like acupuncture, acupressure, or cupping or like chakra cleansing, where it's kind of like what people would say in the West as woo woo, where it's like not legit in that sense. So would you know where that comes from, and also what your take is on chiropractic being an actual treatment?
Yes, because with chiropractic, you can go very evidence-based, or some can go really, really vitalistic or holistic,
Okay.
if you use that term. Part of the reason is some of them see it as they will incorporate some sort of spiritual, not spiritual, but like they will basically they involve and they focus on a lot of self-healing power of yourself. So sometimes it can goes a little bit too spiritual in that way.
I see.
Your body obviously can heal yourself, but I myself will go for a more evidence-based and clinical-based sort of practice myself. Basically, working on more like joint restrictions, balances in the body, muscle imbalances, or say if there is any nerve root compressions on a certain level of your spine, which can cause like numbness and tingling on your limbs. So that is what I will focus more on my practice. So yeah, the not spiritual part, but the
holistic,
the holistic part that you've been talking about just now. There are a bunch of chiropractors who take this type of approach for sure. It's a little bit less evidence based, but you can never say they are wrong because there's nothing that proves it's wrong either. Yeah.
I guess with any profession, every professional who makes it part of their career, they'll take what they've learned and they'll apply their own methods, right? And it's hard to say whether or not it's right or wrong.
Yeah.
If it's effective for their practice and if it's actually serving their clients, and their clients they trust the process in that way, and they're diligent about it and they're seeing results, then would it be hard to say like, well, you're wrong, I'm right, or vice versa, right?
Yeah. So I respect all types of practice.
Okay.
But I think what I'm doing at the moment, I feel the most comfortable.
Sure.
And I feel like that's really helping the patients that I'm seeing. So
Okay.
I'm happy with what I'm doing at the
Yeah.
moment. So if anyone that are seeing a more holistic approach chiropractor and that works very well for them, then go for it.
Yeah.
Yeah.
When you were well, first of all, why did you choose to study this? In your when you were younger, going through your studies, why did you choose this path? And did you know about these types of differences of holistic versus data-based, and having to wrestle with this as part of your career?
Definitely not that holistic and evidence-based chiropractic thingy.
Okay.
Before I start studying this,
Okay.
I think since a very young age, I know that I want to do something or want a job that allows me to move around quite a bit instead of maybe sitting in front of the desk and do a lot of work.
Right.
So I think with my upbringing or growing up with struggling with some sort of well, I say I do have a bit of mental health issues back then. So I wanted to practice something that are helping people with their health physically or mentally. Mental side, I did think about doing that, but it's a little bit too much for me as someone that on and off struggle with some mental health issues.
Like you're going through it yourself, so it's hard to kind of become a professional in it because it's too close.
Yes.
I see.
So I think something more like physical side might be a better choice for me. And I did think about getting into physiotherapy as well back then. But when I was studying and about to get into university, I was looking around, see what else I can choose to be or what else I can choose to study. Then it just comes up to be chiropractic.
Yeah. Did it jump out at you on a course like Record, or did someone, a friend of yours, suggest for you to start studying it? Like, what was the moment that it came into your life?
I was observing quite a few practitioner back then before signing up for any university course. And actually the memory is quite blurred, but I was observing some physio and some mostly physio back then, and then end up connected to a chiropractor, and then I observed them for quite a few days.
Yeah.
And I found that interesting to look into it a little bit more, and eventually I just get into it. Yeah.
Okay. And the rest is history.
Rest is so I got into the degree, went to my first chiropractic college, didn't like it at the very beginning.
Yeah. Why is that?
The way they approach chiropractic and the way they educate us is very fake, and I don't know what's going on.
Oh, okay.
And
Like, it didn't seem actually helpful in practice.
yeah, I don't know what's happening, and the technique and method they are trying to teach us is not what I'm looking for. The quality of education is not very good in my opinion. So I actually transferred to another university afterwards, and that's where I start gaining passion and knowing what I'm doing with chiropractic. A lot more evidence based, a lot more support from the tutors and professors there. Also, I guess a lot of influence from my peers there, because a lot of them are actually very very strong, and a lot of strong athletes in my university as well.
Okay.
So that also actually motivates me, and basically I get more interested in what I'm studying back then.
Got it.
Yeah.
And when you look at the evidence and you look at the data, why is it that it's so important to look at, for example, the spine alignment, the shoulders, the hips, when you're looking at the root cause of anyone's pain? Why is it so influential that you're looking at the trunk?
So looking at the trunk, especially, let's say your pelvis. When there is any imbalances in your pelvis, no matter it's a rotation or tilting or any, forward tilting or backward tilting, that can affect the usage of muscles and activations of the muscles, which eventually can create quite a few compensations in movements, especially if you are training a lot in your daily life. It can only get worse if you don't address it and just go on and squat heavier and heavier.
What you're saying is, for example, if the pelvis is tilted in a way that doesn't accommodate for a good, depth squat, and your body insists on doing that, it'll find a way to do it, but it might come at a cost at certain either hard or soft tissue.
Yes. So basically it's what we call compensation.
Yeah.
Eventually it can lead to an injury, and that's the last thing we want to see when you are training, because
Right.
it takes you ages to recover
Right,
again.
right.
And if you want to train for long, that's something that you really want to address and sort it out as soon as you can and as soon as you notice that.
Okay.
Yeah.
And then your role as a chiropractor is to take the root causes. So let's say if they're having, they're having some pain in the muscle surrounding the pelvis, be it the glutes or the hips or something like that. Your job is to adjust the angle or the position of the pelvis and the surrounding bones and even muscles. That way they would start moving in a way that doesn't compensate.
Correct.
Oh, okay.
Yes.
Is that when you said pelvis, is that the most common type of issue that you see when you look at your everyday client?
Pelvis is definitely something that we fix for all patients, because that will be pelvis is something that really easily get into an imbalance.
Is it
phase.
because a lot of sitting at an office?
A lot of sitting, and they do this tilting motions when you are walking around, basically.
Okay.
So walking is something that can already cause imbalances.
Oh. Okay.
When you cross your leg a lot, and when you only cross on one side, it will also create imbalance, a rotation problem.
It's so funny you mentioned that. I was sitting on the couch like 2 days ago, and I was just like, I don't know what I was doing. I was reading or whatever, and I crossed one of my legs over the other. And my daughter, who's like 8 years old right now, she said, "Dad, you need to stop doing that. It's really bad for your back." And I was like, "What are you talking about? That sounds so dumb." But you're saying is she was actually right.
She is actually right.
Okay, because I was like, I've been doing this for such a long time, and then now I know I have like a slip disc in my L4, L5. So I guess there is some truth to that.
Definitely, if you have an injury, this is something that you want to be a little bit more conscious as well.
Yeah.
But crossing leg itself is not that problematic.
Yeah.
But the thing is, you have to swap side from time to time.
Got it.
Basically, you're not stuck in one position to eventually create these chronic issues.
Yeah. Okay.
Yeah.
All right, Lily. You're right on that one. So I guess the root of this first myth about that chiropractic is not real medicine. First of all, treatment, right? Let's define it as treatment. But it is real treatment because it's looking to solve the root causes for any pains that people have or any imbalances people have in their either extremities or all the way to the major joints, being like the shoulders and the hips. Okay, right on. Next question, the pain element, and as a personal trainer, sometimes clients love to know that they're on the floor at the end of a session, sweating on the floor, feeling like they're in pain, they can barely breathe, and that's for them is a definition of an effective session.
Team, I want to quickly interrupt this episode to give a little shout out to our sponsors, Today Well Spent. This little journal has made such a massive, profound impact on my life since I started using it. When I started using it, I actually didn't know that it was backed by neuroscience, but now it totally makes sense. This has brought a ton of gratitude to my life. It keeps me on track and focused on the things I need to do day to day and brings a lot of context as to how each day fits within the greater week and the greater month. So if you, like me, really care about trying to be a high performer and and want to do everything you can to make that happen, I cannot recommend this journal enough. Use our discount code, THEPROCESS, to grab yours today.
I almost see sometimes, that there needs to be an element of pain or that kind of pain-esque sensation in order to know that you had an effective, whatever, physiotherapy session, massage session, and in this case, chiropractic session. What role does pain play in chiropractic? Is pain necessary?
Pain is not necessary
Okay.
in a treatment. Also, the definition of pain between everyone is different.
Right.
Sometimes if you are, let's say we're doing soft tissue work on your glutes and your hip flexor just now, that could be quite sore when we are working on it.
Okay.
But that some of the people are really sensitive and they will see that as pain.
Okay.
Whereas some of the people might be a little bit more pain tolerant.
Yeah.
So that will be something that, I feel a relief already with that kind of feeling. So it really depends on how you define pain.
Yeah. And also, because I've been seeing a physiotherapist since about April.
Yeah.
And, we'll have a conversation because, it's an hour-long session and stuff. And sometimes I'll just stop in the middle of a sentence and I go, ugh, because she finds a spot. How do you deal as the chiropractor? How do you deal with those pain responses or those signals from a client? Or you can tell, they're really tensing up, or this person's like starting to sweat a lot and the AC's on full blast. Like when you're starting to see that they are actually in pain, how does that influence what you do?
I think first thing I would do is to check in with that patient whether that is manageable for them.
I see.
Yeah. Let's say if they say, I can deal with it.
Yeah.
Then maybe we'll try to still work with that kind of pressure.
Yeah, within their acceptable range.
Yes.
Okay.
Yeah, I'm not trying to kill them, obviously. Yeah, but because it's really essential for us to relieve and release the muscles before we work on any joints, or basically make the adjustment more effective in that way.
Because a tight muscle can really prevent an adjustment?
Yes, and also after doing the adjustment, if the muscle is still too tight, like 30 minutes later, it can pull back into the wrong position. So we don't want to see that.
Yeah. So to that extent, there is a little bit of pain that has to be experienced because of that. That's tightness, right? If you have a tight muscle, if you untighten it, right? If you massage a knot or something, that's not going to be pleasant.
Yeah,
right?
No. Yeah, but if someone are really tensing up like crazy with a soft tissue release, then obviously we have to adjust the pressure that we are putting on them, because they can only be tighter and tighter if they are resisting our pressure.
Oh, okay.
Yeah.
And here's maybe a random question. Again, as a chiropractor, and you're working every day, what are the most common tight spots that people have every day?
You mean muscle-wise?
Yeah.
Upper trap.
Mm-hmm.
And I say glute muscles is pretty
again desk job type of issues. If your upper traps, is it because you're typing a lot?
Yes, and also people are stressed in this city.
Oh, okay.
And they just naturally shrug their shoulders all the time. Also their pec.
Yeah.
So they tend to round their shoulder a lot. That's why people are slouching a lot. That's why. And that will be one of the reasons why they're slouching a lot, because their pec is very tight.
I mean, you said you took the MCR here, and you live here in Hong Kong. When you're walking around, do you see that pretty commonly? How people's natural disposition is super tight in areas that you see a lot?
Especially with posture-wise, you can actually you just look on the street and see millions of people, looking down on their phone. And even though they're not looking down on their phone and they're walking around, you can see that they are slouching a lot already.
And their neck is doing this.
Doing this turtleneck position, which is comfortable for them, but it's very not ideal.
Okay.
Yeah.
Again, I don't know why I'm bringing my family into this. 3 days ago,
Okay.
I was standing and I was looking at my phone while standing in the MTR, and then my wife was telling me, like, Chris, you like, do you not realize how much your neck is craned forward and your chin is down and your back and your shoulders are slouched? I'm like, that's fine. I just did it for a second. But I think the problem is you can kind of make it a habit, right? Without even noticing it. And that's where it becomes an issue, when it becomes a chronic thing that you do. Oh boy. Yeah, I'm learning a lot. This is more about me confronting my own issues more than it is about busting myths.
Right.
Now in the realm of pain though, if you are alleviating the symptom or the root causes, should there be then less pain on the long run? I guess that's the natural path of all this stuff.
Yes, definitely. Obviously, people usually come in with, let's say, the most major or most common complaint that they come in for will be back pain, upper back tightness, and neck pain and headache.
Okay.
Usually when we do our initial assessment just now, they can already feel that it's hurting when we are palpating on those certain areas.
Sure.
We obviously work on muscles, but our main thing is still doing a chiropractic adjustment on those joints. Usually, couple sessions in, they should start to feel a little bit of release and more better with range of motion.
And it would last for longer, that relief.
Yeah. So initially, because of the imbalance component of the muscles and also how your body adapt to those kind of positions for a very long time already, those adjustments won't hold long.
Okay.
Maybe a couple days. But in long run, when your body start to adapt to that kind of positions with your joint,
right?
We work on the muscle component as well, and obviously our patients need to be, disciplined enough to do their rehab stuff.
The stuff that they do at home.
Yeah. So the pain will definitely gone down.
Okay.
Yeah.
So that brings into naturally the next myth, is the idea of the noise that you experience and the noise that you hear with chiropractic. And this is where, we had our session this morning. Yeah. And that was my first chiropractic session, I think, in life, like formal one. I've had people like,
to be your first chiropractor.
That was, you were my first chiropractor. I mean, like official one. I've had one time, like, people who helped me crack my back because they saw something on YouTube where they did it for somebody else, where I cross my arms and they come from behind and they pick me up and then they like bounce me on them. And then like I hear my back crack. So that was like the whole fear, right? That's why I went to see you. I was like, I need to confront this fear that I had since I was a child. And we experienced that a little bit where you cracked somewhere in my back, my thoracic, because you said I had a bit of kyphosis. My shoulders rounded a bit. I heard a bit of a crack in my neck. But again, this isn't a crack. So first of all, before we get into this, can you break down really quickly, scientifically, what is that cracking noise that we experience in chiropractic?
Right.
Chiropractic.
So, cracking is actually a popping sound that creates within a joint when there's gas bubble release from the joint itself.
Okay. And where does that gas come from?
The gas come from the rotatory of basically the gapping motion. Yeah, the gapping motion of the joint. Okay. That would create a space in between the joint.
So you get like a pocket and that traps air?
Yeah, because there's supposed to be liquid in your joints. To basically, they do what they do is to absorb shock for your bones.
Right.
So they have to be hydrated in those discs to allow movement happening. And when we do adjustments, we basically gap out those joints. So there are more space created within the joint. That's why there will be a gas bubble created and popped.
Okay.
Yeah.
So with that being said, and in our session of about 45 minutes, and I don't remember how many adjustments that you did for me, but I heard maybe 4 pops or cracks, and they were like small isolated ones. It wasn't like a huge, it wasn't like someone like chomping down on a potato crisp or something like that you see like on social media.
Right.
But the idea of, okay, myth number 2 was you don't have to sense pain, but that can happen.
Mm.
Myth number 3, do we need to have that cracking noise?
Not necessarily.
Okay.
The cracking noise is just an indication of, one of the indication of a joint or the joint being moved.
Mhm.
But there's a lot of other factors that can affect whether there will be a popping sound. For
Mhm.
example, whether you are hydrated that day.
I see.
If you are dehydrated, your disc will be dehydrated as well.
Mhm.
So there could be a chance that the disc is too dehydrated that they are not able to create that gas bubble to pop.
I see.
Another thing is when your muscle is guarding too much,
Mhm.
an adjustment is very hard to force an adjustment basically because your muscles is guarding
Okay.
and you are in pain.
Yeah.
Usually that's when people in pain, they will guard a lot on their muscles.
Yeah.
Yeah. So
When you say guard, you mean like they're tensing up?
tensing up, yeah. They will tense up and basically don't want to relax.
Yeah.
And at that moment, if we keep on trying to do manual adjustment,
Yeah.
that will actually hurt them and strain their muscles. So that is a time that we don't want to do manual adjustment. Instead, we'll do a lot of muscle work and mobilization work. Adjusting with a tool instead of using, hand to adjust,
Mhm.
because that will be the best for them. And again, as we mentioned, people come in, our goal is to reduce the symptoms,
Yep.
reduce the pain,
Mhm.
and get them to move better.
Mhm.
But not like they come in, my goal is to crack all their joints. So our goal is symptom care
Yeah.
and conservative care.
Yeah.
We want the patients to feel better. That's
Right.
why we do whatever that is suitable for them
Mhm.
for that day.
Good.
Yeah.
So, I mean, there were one thing I picked up specifically when we did our session was you were like readying me for each of the faster movements, because some of the movements does require kind of swiftness in the motion to do the adjustment, right?
Mhm,
Like it's not a slow, like pressure. It's like a quick, movement.
Yeah.
So I remember you said, okay, you describe what's going to happen. And then you said, I need you to breathe in, breathe out, and relax your shoulders.
Yeah.
And then this is me just thinking like, all right, I guess this is going to happen right now. And then when I breathed out, you just did it real quick.
Mhm.
And then it was just like, oh, there was that. Even like, I think the one time I did tense up was when you're on my neck.
Yeah.
Cause it was like, oh shit, here we go. It's the neck. Am I going to die? Like, am I going to walk out of here or not? Right? Like
my childhood trauma.
yeah, exactly.
coming back.
Like this is it. And I think you can sense some tension there. Like I was resisting. So then you were just kind of very gently talking me through what's going to happen, then just to breathe and then take another deep breath in. And then you did it. And then like there was nothing there except for like, just like, again, just a slight like popping sound, but no pain, nothing like, back breaking or what you see on social media videos. So I guess my question for you is, as a chiropractor, when you see these videos and especially when they're viral, what is like your attitude about them and their virality?
Definitely, I came across a lot of them.
Yeah.
And I've got a lot of people sending them to me as well.
Like, can you do this?
It was like, I think they're just making fun and trying to, I think they will, because a chiropractor in Hong Kong is not that common. There's not a lot of chiropractor in Hong Kong. So whenever someone knows me or they met me through some whatever reason, they know me as a chiropractor. Whenever they saw a chiropractic meme, they would just send it to me. Yeah, so that just happens.
You're the
on
one
a daily
chiropractic friend.
on a daily basis.
Okay.
My attitude to them is, I understand why they would do this, because it's eye catching, and social media is all about catching attention.
Sure.
If you are, I'm sure that people would rather watch a cracking video with dramatic reaction instead of seeing me sitting here, spend 2 minutes talking about why am I doing an adjustment.
Yeah, and why it's trapped gas and stuff like that.
Yeah, so I totally get that, but that actually does create a lot of misconceptions, and people don't really know why we first of all, don't know why we are doing an adjustment.
Mm.
Don't know how an adjustment actually being done. Don't know why, what do we assess before we do an adjustment.
Yeah.
All they know is like, oh, crack. And
So does that mean that when you get a new patient into the room and you haven't seen them for the first time, part of that initial consultation is dispelling these misunderstandings? Or do they already have an understanding and that's why they're seeing you?
Depends.
Mm-hmm.
Some of the, I won't say a lot of them will come in with that kind of expectations, because a lot of them actually come in with a certain pain already.
Mm-hmm.
So they know that they need to see a chiropractor.
Okay.
Let's say someone with this a bulge disc,
Mm-hmm.
someone with chronic neck pain,
Mhm.
chronic tightness on their back. So they somehow have an idea why they have to see a chiropractor already.
I see.
Do time to time I have to debunk this as well.
Yeah.
But I also don't want to keep diving, like keep explaining to them
Yeah.
with all of those, because unless they actually bring it up to me, then I will
Right.
go and explain.
Yeah.
But obviously I still have to run and guide them through what we are doing so
Yeah.
that they are clear enough that we are what's going on in the sessions and why and what are we adjusting for them to make them improve and make things work.
Yeah.
Basically.
Like there's definitely like you're basically guiding them through the experience.
Yeah.
You know, and making yourself a trusted individual to go through that journey with them. Okay.
Yeah, because I also don't want to expect, like, have this expectation of, oh, everyone should have go through and, you know, scroll through a chiropractic meme in their life for sure, and then they will expect chiropractic will look like this
Yeah.
already. Because again, I feel like assuming is not great.
Right.
Yeah, so I will wait until somebody bring it up to me,
Oh,
then I'll
okay.
go, okay, I'll
I mean,
just,
I don't mean to do this to you again, but there is that one meme or one video. Did you see the one where there was like a German chiropractor who was working on animals, like dogs and cats?
There is animal chiropractic.
Yeah. So like he was holding like a pit bull, like, and they had a tight neck, and then he was holding its head, and he just kind of twisted it, and like it made that cracking noise. I mean, he had a microphone on him, so it made the cracking noise much more pronounced. And then the dog just looks at him in disbelief. And it was happening all the time to the animals. Were like, "Oh, I've never experienced that before." So that is also legitimate, like animal chiropractic.
There is a master degree on animal chiropractic as well.
Wow. Okay.
I think there's a couple chiropractors in Hong Kong actually got that degree, but they can't practice here because, I don't think there is a way for them to practice in Hong Kong.
I see. There's still local laws and regulations, and for Hong Kong, that's not allowed at the moment.
Yeah.
Okay.
But I do say actually animal chiropractic is very, very helpful for animals
Oh,
because
okay.
they are walking in different ways,
Mhm.
and their spine lies on their body in different ways,
Mhm.
especially with gravity.
Mhm.
If you're walking on your force,
Mhm.
actually and if let's say you're overweight, like
Yeah.
the dog is overweight, there's actually a lot of pressure on their spine, and they could be in pain that you never
Yeah.
know.
I guess like imagine if we were in a plank position all waking hours.
Yeah.
How uncomfortable that could
And
be.
you got a big belly.
Yeah.
And that's
Like it's gonna make that spine really kind of dip in the middle, right?
Yeah. So actually, I would say chiropractic with animal is legitimate, and honestly speaking, I would say it's actually very helpful and good for animals.
Yeah.
Yeah.
Huh. Nice.
Yeah.
That was cool to clarify that.
Yeah.
All right, ready for the next myth?
Please.
Myth number 4, once you pop, the fun don't stop. So the idea of you get adjusted, but you know, once you get adjusted, you'll always have to come back. And to what extent is that true? Because that you were referring to in the beginning that there is that beginning period if someone's never seen a chiropractor and has never gotten an adjustment, especially if they have such tight muscles that they can revert back. That there is going to be a period early on to do more frequent sessions, but then after a while, what's the end game? Like, is the end game to never have to see a chiropractor, or is that something that's like maintenance? Walk me through what's the frequency here for a chiropractic care.
Okay, right. So let's say you are a patient that comes in with an injury
Mhm.
or a chronic pain.
Mhm.
We do have to see them a little bit more often
Mhm.
to balance out everything. This is something that we call a corrective phase.
Okay.
Um,
Corrective phase.
yeah, corrective. So we want to, by the end of this corrective phase, we want to see at least things are starting to get balanced and almost balanced, or even like completely balanced.
Mhm.
Let's say, shoulder height is balanced, pelvis is balanced,
Mhm.
leg length is balanced. Symptom wise, we see a significant improvement.
Okay.
Then that is the time that we'll start to phase out, and we don't have to see our patient that often. Is there an end game? Definitely, you can see a chiropractor only when you are symptomatic,
Mhm.
but we do recommend doing maintenance adjustments
Mhm.
to make sure or keep whatever we have achieved on the corrective element
Mhm.
to the whole chiropractic um, adjustment and treatment.
Something like almost like I think you mentioned it earlier, almost like seeing a dentist every 6 months. It's not
Yeah.
you shouldn't have to see a dentist only because you have cavities or need a root canal.
Mm-hmm.
Just see your dentist just to see if everything's okay.
Yeah.
And then make minor adjustments as needed rather than wait a couple years for a big adjustment.
Yep. So it's totally not saying that, if you don't do maintenance care, you're fucked up. No, that's not true.
Okay.
But we do recommend doing maintenance checkup. The reason being is, let's say you're just a normal office job person.
Mm.
You sit in front of the desktop for like 8 hours,
Yep.
not moving at all, and maybe you go for a football match for fun,
Yeah.
and then things will just mess up, right?
Yeah, you're describing like 90% of the young and
The
able
weekend
population.
warrior.
Yeah.
And also when you are sitting in a certain position for a very long time,
Yeah.
that will create restriction in the joint already.
Sure.
And for someone that moves a lot, let's say any of the member in Coastal Fitness,
Yeah.
all those movement can also potentially move the joint into a not right position.
I see.
And you don't in CrossFit world, you don't want to do maintenance training. You want to push.
Yeah.
And especially maybe you're testing for
Sure.
certain things.
Yeah.
Things will mess up. Like your form might mess up.
Right.
Stuff might mess up. You just go, out of your mind when you're pushing.
Sure. I mean, life happens, right? And
Yeah.
in this case, the thrill to perform happens. And when we want to perform and we want to work at the highest level, that doesn't always necessarily mean working towards longevity and health, right?
Yeah.
It's a continuum. And sometimes we work out towards health and longevity, and sometimes we work out towards performance and whatever, competition or a PR. And that has you pushing certain limits.
Yeah.
And in this case, it could be like your structure.
So that can also create a potential imbalances in your body, and potentially again can long term it can become an injury. So that's why we encourage people to do maintenance care to basically to, if you want to lift longer,
Yeah.
if you want to be mobile longer,
Yeah.
if you want to feel good for longer, this is what we will recommend.
Okay.
Yeah.
And this is, this may be the jumping off point from talking about myths to about yourself is you're a chiropractor and you've been practicing it for years. You're only recently been a member here at Coastal Fitness and therefore doing CrossFit and strength training only a year now, maybe less than that even?
Less than a year.
Yeah. So why did you decide, knowing that, that the structure of the body, there's bones, but then there's also muscles that surround it. Why did it finally become important for you to finally commit to doing strength training yourself?
So that's a long history actually. So
I mean, from a chiropractor's lens.
Okay, from a chiropractor lens. What we educate our patients, and what we try to suggest or advise to our patients is to do rehab on themselves
Mhm.
during the recovery journey,
Mhm.
because it's actually really important to work on a lot of things. Actually depends on how hardworking on yourself to and how much you want to recover
Yeah.
with all those rehab and stretching stuff that we prescribe to our patients.
Mhm.
So I think putting myself in their shoes,
Okay.
first of all, training. I know that strength training is very important to improve, longevity of your body functioning, and also prevent injuries. With CrossFit, obviously, it could be quite injury prone. The reason why I'm
What are you
doing
talking about?
CrossFit. No. Okay, right. CrossFit is something that is covered when I start to get slightly bored with my own strength training
I
stuff.
see.
So far, I have a lot of fun and I love it.
Mhm.
But I would say that with training in CrossFit, I understand more about how an injuries happen
Ah.
and how that injury actually feels. Obviously, as all the materials and information we study in university,
Mhm.
we know what's going on in your body, but how exactly it feels, like you can't have all the injuries
Yeah.
and you have all the ideas of how that injury can feel like, and not everyone can use the same protocol of rehab
I
and
see.
strengthening.
Now that you've been doing CrossFit for still less than a year, but long enough to have a good understanding, what is the reason that you see people get so injured so often? Is it what you said before about people just kind of pushing past their limits too much, or is it just not being ready for the movement at hand or the intensity at hand? Like, from your experience, what does it look like?
I think it's the component of like pushing themselves a lot, that they want to get a PR or they want to be better in a competition. Then that is the time that you won't go and think about whether that's gonna injure yourself at that moment.
Yeah. It's like, is it enough to win, or is it enough to get a PR, or is it enough to, I guess, break through some standards that I've set for myself
Yeah.
in some way?
They won't go and think about, oh, is this going to, this get a is my this gonna bulge out after this whatever
Yeah.
movement I'm doing?
I mean, you yourself. I mean, we had testing today in our group training of a 5 rep back squat as an example. Did you find yourself having that internal struggle yourself
About
about whether or not to push your limits, or do you know, as a doctor, I probably shouldn't?
I probably didn't think about it in a chiropractic way at all.
See, like you don't have the chiropractor's hat on when you're working out, in a sense.
I do say so. I still have an idea whether I will injure with that,
Mhm.
but as someone that trains here, you probably just want to go for it.
Right.
So I do say I totally understand why this
Mhm.
happens to people, and
Okay.
I am definitely one of them at some time and
Yeah.
at some point. But that's why I also have to see my colleague
But
from time to time.
I mean, that's cool that you have a better understanding, because now you have an idea of like even a 6 to like, let's say a 6-month recovery period, right? Like, let's say we're going to take it slowly and take 6 months to do this. That, from maybe a chiropractor's view, that's a very small amount of time to fix something that might be major in 6 months time. If you follow these guides, you'll be great. From a person in the realm of CrossFit or whatever, weight training or powerlifting or strongman, when they have competitions or when they're training all the time, they love it. Now that 6 months is a really long time. And that's a time when you can get really tempted to go off course and be like, actually, I feel great. Let's just go for it. And that's when maybe you would take a step, you make progress and then take steps backward because you went heavy too soon or something like that. You have a better understanding for that type of mindset.
Yeah, definitely. So I do understand that most of people, if they train daily, it's very hard for them to stop to train even for 2 weeks.
Yeah.
So But also in my practice, usually with someone that have, let's say, acute injuries, yes, stop for training for, let's say, 2 weeks is essential. I would say, to allow the symptoms to die down. But it also doesn't mean that they can't train at all. But their goal of training will have to change to something else, like maybe strength, stability, control of the movement. So it's definitely not like you have an injury, you can't train.
Yeah.
But you can still train, and maybe actually you can do half of the or 30% of the program that you used to do as well. Depends on your progress and depends on how well you recovered and how much you stick with the rehab.
Okay. It's
plan.
like telling that client, look, you need to address these certain things about the way that you move, and if you address that, maybe it means you're stuck at 60% or less of your training weight, but you are going to definitely address, the imbalances between your hips or your improper core bracing technique, or you're not activating your glutes. Like, these are the things that you can work on, even at lighter weights, for example.
Yeah. And even say people that are not coming in for like a major injuries, but they notice they have this imbalancing issues. They can totally do their usual training for sure. But maybe they have to do more of an accessory work or activation work before the training or after the training. Yeah. So it's like, it's not that often that we'll ask the patient to completely stop workout. So yeah, that's the case.
Yeah, it's just making sure that they are aware of what's going on.
Yes.
Okay.
Yeah, and then we are keeping track of their feelings, how they're feeling, and how their progress is.
Okay.
Yeah.
Now, on that note, as we kind of wrap things up here, is now that you've seen both sides as a chiropractor and as a person doing strength training and CrossFit, do you have any quick tips or advice for anyone to not get injured? I mean, one of them sounds like, make sure that you understand when you're pushing your limits and what that could mean before you decide to do it. But anything like practical advice?
Practical advice will be focused a lot on, actually the most important thing for any sort of training is core strengthening for sure.
Yeah.
That I think most of the people would agree.
Yeah.
Core strength is so important for everything, no matter protecting your spine, your back. That is one major component for chiropractic. As a chiropractor, to give advice. Performance-wise, also strong core is very important for you. Mobility work, and also a lot of warm-ups and stability work before you get into a training is also really important.
Yeah.
Especially if you are a morning trainer, a training person.
Yeah.
When you wake up from your bed, you have been staying in that position for like 6 to 8 hours. You are pretty tired.
Sure.
At that moment, and you just walk into the gym and then do your own training without any warm up.
Yeah. You're saying everything that I'm doing wrong. My training is so I'm just listening to you right now.
So there's something that I'm trying to work on myself as well, because I also train in the morning and I want to get as much sleep as I can possibly do. So resolution to myself, for myself as well, is to really stick with more warm up, more activation work, more
core work,
stability work.
You're saying do all the unsexy stuff that people don't like to do.
Yeah.
Warming up, core work, mobility work.
Yeah, it's the most boring stuff and the most time consuming stuff.
Right.
But it's
it really does.
So
pay
that's
off.
why I was saying that I always put myself in their shoes, because I'm one of the person that hate doing all the stuff. But I try to do as much as I can.
Sure.
I know when people are busy and they are tired, they just want to walk home and just get some more rest.
I hear that.
Yeah.
Okay. Good to know. Now, all things aside, I learned a ton about chiropractic and yourself as a chiropractor. The last question that we have for all our guests is totally not related to any of this stuff.
Right.
Is Erica, Dr. Erica,
Oh, please.
In any way you want to answer this question,
Okay.
please describe your perfect day.
My perfect day.
Yeah.
My perfect day will be.
How does it start?
It will start with waking up before my alarm,
Nice.
so that I'm not irritated or annoyed by my alarm.
So you're peacefully waking up before or after sunrise.
I usually wake up actually before the sunrise.
Okay, nice.
Yeah. And having enough time to make myself a coffee
Mm-hmm.
and then do my morning training.
Okay.
I've got some time to do my accessory work
That's
on
right.
some of my not so great stuff.
That's right. Mobility, warm up
Um,
core, all that.
Yes. And then get some nice PR in.
Okay.
Okay. Get a good shower, get some brunch with my friends.
Mhm.
Had a good conversation with them.
Mhm.
And a lot of sunlight on that day. Some family time in the evening.
Mhm.
And that's it. I think it's very simple.
Yeah.
And it's just, I like to have some personal time as well maybe in the afternoon. So
Mhm.
that is a good amount of, self time,
Yeah.
me time, and socialing time.
Awesome.
That's it.
That's a good day.
Yeah.
Well,
you agree?
yeah. I mean, I could do that. I'd like to have some of that.
Right.
So Dr. Erica, thank you so much for talking to me about all these myths. Thank you so much for inviting me to UpHealth.
No, thank you so much for inviting me to the podcast.
It was great. So if we want to find out more about you, more about UpHealth, where can we find you and clinic?
You can find me through my Instagram.
Mhm.
You can also check out uphealth.com.
And if you're local to Hong Kong, where is UpHealth located?
UpHealth is located so we got 2 locations. We
Great.
got our central location
Mhm.
and we have our Admiralty locations in Pacific Place apartment.
Okay.
Thank you.
Awesome. Well, thank you so much for coming on to the show and letting us know everything about your profession.
Thank you. Thank you for inviting.
Right on.
Yeah.
Podcast PR.
Yay.
Right on.
Before we say goodbye, here's one crazy statistic for you. Did you know that almost 40% of people who listen to the show don't actually subscribe to it? Now, I didn't think that was a big deal until I actually learned about the power of hitting subscribe. For you, the listener, you get to stay up to date when we drop episodes on a weekly basis. But for us as a podcast, it really helps our visibility and helps us attract great brands and great listeners to help grow this podcast. So if you enjoyed this episode or you're a big fan of the show, please do us a massive favor and hit subscribe. Thank you so much.